imagine running like a high-stakes emergency room, but your primary triage nurses are just a group of exhausted mothers with zero medical budget. And I mean, absolutely no formal authority.
That is quite the visual.
Right. But that vivid, somewhat jarring picture is basically the invisible infrastructure of the modern American school system. Like, we assume schools are held together by brick-and-mortar buildings, tax dollars, district administrators, all that stuff.
Which is what you see on paper, yes.
Exactly. But when you look at the day-to-day reality of student wellness, you realize the safety net keeping these kids afloat, it's not made of institutional budgets at all. It is held together by an entirely different, mostly unseen force.
Yeah, and it's a dynamic that has been completely taken for granted for decades now. I mean, we look at the visible structures of education and we just assume they are the entirety of the machine.
Right.
While completely ignoring the human capital that is actually absorbing all the systemic shocks.
Yeah, which is exactly what we're going to get into. Welcome to the deep dive, by the way. Today, we are looking at the intersection of student mental health infrastructure and that unseen emotional engine of the K-12 school system. Specifically, the mothers carrying the load.
It's such an important topic.
It really is. And for you listening, we're basing this on a very specific, brief, but just incredibly information-dense source document. It's titled MentalSpace, Georgia, Honoring Mothers and Student Wellness.
Right, the MentalSpace brief.
Yeah. And our mission today is to figure out how targeted K-12 mental health support systems are finally stepping in to back up this relentless advocacy of parents. We're looking specifically at a model rolling out in Georgia, what it offers, and honestly, what it reveals about the massive gaps in our system.
There are definitely massive gaps.
Oh, huge ones. So, okay, let's unpack this, because I was reading through this MentalSpace document, and I have to say, something really threw me off at first.
The opening.
Yeah. It opens with a Mother's Day tribute. And I was like, wait, why on earth is a clinical mental health proposal starting with a poem about moms?
Yeah, it definitely catches you off guard at first glance, but as a framing device for an educational and clinical services overview, it's actually kind of brilliant.
Really? How so?
Well, because it immediately identifies the void. The text paints this incredibly vivid picture of what it calls school moms, and it defines them by their unstoppable strength, you know? It lists out these highly specific actions that literally any parent listening to this will immediately recognize. It talks about the mothers who fight for their child's spot in a class or, you know, a spot in a specialized program.
The ones who show up to everything.
Exactly. Every single Tarrant night, game, recital, conference.
Right.
Even when they are operating on, like, 3 hours of sleep.
Yeah, I mean, it essentially describes a project manager running a high-stakes startup.
Yeah.
But the product they're trying to launch is a human being's successful future with zero budget.
It's a perfect analogy.
But I'm stuck on this one phrase in the text. It says, these moms advocate when no one else will.
Right.
And, I mean, it sounds beautiful and poetic in the context of a Mother's Day tribute, but isn't that actually a massive red flag? Like, why are we romanticizing the fact that the system is failing these kids to the point that moms have to do it all?
Oh, absolutely.
Right, because if moms have to advocate because no one else will, that just highlights a complete structural failure in how we support students. Are we really just relying on moms to be the safety net?
And that tension you're feeling, that is the entire subtext of the document. Calling maternal strength the engine that schools depend on is essentially a tacit admission that the institution itself is missing an engine.
Yeah.
In a fully functional, perfectly resourced educational ecosystem, a parent shouldn't have to be the sole advocate fighting for a child's basic wellness or inclusion.
They shouldn't have to fight at all?
Right. They shouldn't have to spend years battling a district just to secure an IEP, you know.
The individualized education program.
Exactly. The legal document that basically forces a school to accommodate a kid's specific learning or behavioral needs.
And getting one of those is notoriously like pulling teeth. I mean, it takes months of emails, endless meetings, independent testing that parents often have to just pay for out of pocket.
It's exhausting. And that is the reality of a reactive system, because in a reactive system, the squeaky wheel gets the grease. Mothers have had to become that squeaky wheel out of pure necessity just to force the machinery to pay attention to their child.
Yeah, to get any sort of customized help.
Right. So the document honors them, but it also really acknowledges the completely unreasonable burden placed on them to be that structural engine. Because you can't just run an engine on fumes forever.
No, you can't. Which I guess begs the question, if moms are currently exhausted from being the only safety net, what is the actual structural solution? Because the alternative to relying on exhausted moms is building an institutional backup.
Exactly.
And that is what this document is actually pitching,
Right.
the MentalSpace school model.
Yeah. If the core issue is that parents are carrying the entirety of the mental health and advocacy burden, the solution has to be a comprehensive school integrated system. And the MentalSpace model for Georgia K-12 schools aims to bridge that exact gap.
Okay, so what does that actually look like on the ground?
Well, the services they outline are incredibly robust. I mean, they offer same-day teletherapy,
It's same day.
same day, along with dedicated therapist teams per school, and they explicitly list crisis intervention alongside suicide and violence prevention.
Wow.
Yeah, and they even fold in staff wellness and family counseling.
Okay, wait, logistically though, how does a kid do same-day teletherapy in a crowded high school? Like,
Yeah.
are they just sitting in the back of algebra class with an iPad talking about their trauma? How does the mechanism of that actually work?
Good question. No, it requires dedicated physical infrastructure within the school itself. So usually this means the school designates a specific, secure, private room.
Like an office?
Yeah, often near the counselor's suite or the nurse's office. So a student in distress can be discreetly routed there, logged into a secure terminal, and immediately connected to a clinician.
That makes way more sense.
Right, and think about the alternative. Historically, if a student was having a mental health crisis, a parent would be called away from work, they'd have to drive to the school, pull the kid out, and then try to find a private practice therapist who might not even have an opening for like 3 weeks.
Which puts the burden right back on the mom's shoulders, frantically making phone calls on her lunch break, trying to find literally anyone taking new patients.
Exactly. So by establishing same-day access right on campus, MentalSpace synthesizes speed with consistency. And what's fascinating here is that the text emphasizes dedicated therapist teams per school.
Meaning it's not just a call center.
Right. It isn't just a random telehealth doctor on a screen who doesn't know the child. It is a specific team assigned to that school. So they understand the culture, they communicate with the administration, they know the unique environmental stressors those students are navigating.
It builds a relationship.
Yes, a continuity of care that is usually impossible to achieve in a public school setting.
I want to talk about the sheer scale of the services they list, though, because here is where it gets really interesting to me. We go from talking about, general wellness and family counseling to the sudden, very stark reality of crisis intervention and suicide and violence prevention.
It's a heavy shift.
It's a massive escalation in scope. It feels like we're taking the traditional school nurse's office, where you used to go to get a Band-Aid or maybe a peppermint for a stomachache, and turning it into a frontline psychological triage unit. It says a lot about what a school is actually expected to handle today.
Well, the paradigm has completely shifted. Schools are no longer just centers for academic instruction. They have basically become the primary hubs for pediatric public health.
Yeah, that makes sense.
And the explicit inclusion of suicide and violence prevention acknowledges a very dark but very real truth. You cannot teach a child who is in acute psychological distress. The school has become the de facto triage center simply because it is the one physical location where children are guaranteed to be for 8 hours a day. If you want to catch a crisis before it escalates into a tragedy, the intervention has to live where the students already are.
But, and I'm sure you'd agree, a frontline triage unit is completely useless if people can't actually get in the door.
Yeah.
I mean, you can build the most state-of-the-art mental health facility inside a high school, but if the logistical barriers block the students from using it, it's just window dressing.
Oh, absolutely. The logistical scaffolding required to make a system like this work within a public school setting is immensely complex. That is exactly where most of these initiatives historically fall apart.
Because navigating health insurance is like trying to solve a Rubik's Cube blindfolded in the dark. And navigating dual compliance in a school setting is like trying to use an American credit card in a European vending machine that only speaks French. The systems just aren't built to talk to each other.
They really aren't.
But the text lays out a very specific logistical framework to bypass that.
Mm.
First, it notes that the therapists must be licensed, diverse, and culturally competent.
Which is key for student trust.
Right. Then, it dropped this massive list of insurance providers to show the scale. It says they accept BCBS, Cigna, Aetna, UHC, Humana, Peach State, CareSource, and AmeriGroup.
That's basically everyone.
Yeah. But the detail that jumps right off the page is their policy for Medicaid patients. The cost is $0.
And removing that financial wall is the linchpin of true accessibility.
How so?
Well, if that exhausted mother we discussed earlier finally gets her child access to a dedicated school therapist, but then receives a massive copay bill in the mail that she can't actually afford, the intervention stops immediately.
Right, she pulls the kid from the program.
Exactly. By ensuring that Medicaid covers the service at zero cost to the patient, they guarantee that the most economically vulnerable students have the exact same access to crisis intervention as an affluent student.
And mechanically, schools hate dealing with Medicaid, right?
Sure.
Like, they aren't medical billing departments.
Not at all.
So having a third-party model like MentalSpace actually process those claims takes a massive administrative headache off the school district's plate.
It does. It allows the school to focus on education while the clinical team handles the healthcare bureaucracy. And that bureaucracy extends far beyond just billing, by the way.
Oh, I'm sure.
The document explicitly highlights the strict regulatory compliance necessary to operate, specifically mentioning HIPAA and FERPA compliance.
Okay, let's break that alphabet soup down for the listener.
Mm-hmm.
Because the friction between those two acronyms is usually what kills school-based health programs before they even start.
It is a nightmare. So HIPAA is the federal law protecting the privacy of patient health information, usually applicable to doctors and hospitals.
Right.
FERPA is the federal law protecting the privacy of student education records applicable to schools. When you place a healthcare clinic inside a school building, you suddenly trigger both. Yeah. So let's say a student is acting out aggressively in class. The math teacher, under FERPA, needs to know how to safely manage the classroom environment. But the therapist, under IPA, cannot legally disclose the clinical details of the student's trauma that is actually causing the aggression.
So they are essentially legally walled off from each other, even though they're trying to help the exact same kid.
Exactly. Building a system that can legally and securely share just enough information to help the student succeed academically without violating their strict medical privacy is a monumental legal headache.
I can imagine.
MentalSpace provides the dual compliant bridge. They already have the legal and technical architecture in place to satisfy both federal mandates.
Okay. And then there is the state-level mandate. The text mentions support for something called HB 268 compliance, and it highlights a looming hard deadline of July 2026. What is the actual mechanism of that bill? Like, what does it force schools to do?
HB 268 is specific Georgia legislation that essentially mandates schools to have formalized, actionable protocols for student mental health crises and safety. It means a school district can no longer just rely on, an overworked guidance counselor to casually handle mental health issues as they pop up. They have to have a documented, systemic answer for how they intervene in a crisis.
So what does this all mean? With this HB 268 deadline approaching, July 2026, this completely changes the urgency. A mental health program isn't just a nice-to-have supplementary program for a PTA brochure anymore. Does this impending deadline change the urgency for schools to adopt these all-in-one systems?
Oh, completely. It becomes a legal operational requirement. District administrators are often overwhelmed just trying to keep the lights on, the buses running, and the teachers paid.
Right.
Asking them to design a dual-compliant, medically robust, insurance-integrated, legally sound mental health system from scratch is virtually impossible.
Yeah, they just don't have the bandwidth.
That impending deadline means schools are actively scrambling for turnkey solutions. They need a system that already has the APA and FERPA protocols built in, already has the insurance networks established, and can immediately satisfy the state's legal requirements.
Okay, so we had this massive logistical scaffolding in place. We've got the HEMA-FERPA bridge, the $0 Medicaid access, the same-day teletherapy room set up right down the hall from math class. It all sounds great on paper as a turnkey solution to relieve these exhausted parents. But that begs the biggest question of all. Do we have proof this actually works? Like, is it making a tangible dent in the crisis?
That's the million-dollar question. A system can be perfectly compliant and flawlessly built, but the outcome metrics are what ultimately justify its existence.
Right.
The document provides 3 highly specific data points regarding their impact, which is crucial for schools or parents who might be reaching out to them. And just as a side note, the text mentions they can be contacted via mentalspaceschool.com or at mentalspaceschool@sheettherapy.com to initiate these programs.
Good to know. And looking at the numbers they provided, it's a really interesting spread. We see 89% improved attendance, 92% reduced anxiety, and 85% family satisfaction.
It's a very smart, 3-pronged way to measure success because it captures the holistic impact across 3 entirely different domains.
Break that down for me.
Sure. So you have the 92% drop in anxiety, which proves the clinical side is working. The same-day interventions and the dedicated therapists are actually providing effective medical care.
Right, that's the clinical metric.
Exactly. Then that clinical success directly feeds into the 89% boost in attendance, which is the educational metric.
Right.
Because chronic absenteeism is the biggest predictor of a student dropping out.
Well, yeah, because you simply can't learn if your panic attacks are keeping you home, or if you're suspended for behavioral issues stemming from untreated trauma, you literally aren't there.
Exactly. And then, crucially, you see the relief ripple out to the wider community with that 85% family satisfaction rate. That metric circles all the way back to our opening discussion about the school moms.
Yeah.
It measures the direct, tangible relief provided to that exhausted parental engine.
I have to pause on those numbers, though, because looking closely at them, there is a discrepancy that feels incredibly telling.
Oh, what do you mean?
Well, the clinical interventions are so successful that student anxiety is reduced by a staggering 92%.
Mm-hmm.
But the family satisfaction is lagging behind at 85%. I
Mm-hmm.
mean, don't get me wrong, 85% is still a solid B. It's a great number.
Yeah.
But wait, if anxiety is reduced by a staggering 92%, why is family satisfaction lagging behind at 85%?
Uh,
Like, if my kid's anxiety virtually disappears, shouldn't my satisfaction be at 100%? Does this imply that even when the student is clinically doing better, the parents are still carrying the residual burnout from having to fight so hard in the first place?
Oh, wow. That is a profoundly insightful way to look at that data. You're highlighting the invisible long-term toll of prolonged advocacy.
Yeah.
When a mother has spent years fighting a hostile or reactive system, battling administrators for an IEP, spending hours on the phone with insurance companies, managing daily emotional crises in her living room, her nervous system is essentially stuck in a permanent state of hypervigilance.
It's like phantom limb pain, but for parental stress. The crisis might be gone, the kid might be doing great with their new in-school therapist, but the exhaustion from the years-long fight just lingers in the parent's body. The threat is gone, but the armor is still on.
Yes. The introduction of a comprehensive support system like MentalSpace might immediately alleviate the child's acute anxiety, which perfectly explains the rapid 92% reduction. Children are incredibly resilient, and they can adapt to relief very quickly.
But the parents don't.
Right, the parent doesn't instantly drop their armor. That 85% family satisfaction indicates profound gratitude, but that missing 15% likely represents the trauma of the prior struggle.
That makes so much sense.
It takes a long time for a family to genuinely trust that the safety net is actually going to hold this time. It takes time to realize they are finally allowed to put down the overwhelming weight of being the sole engine of their child's survival.
Which perfectly explains why they explicitly included family counseling as one of their core services alongside the student therapy. They recognize that you can't just treat the kid in a vacuum. The parents need systemic support to process and heal from the burnout of advocacy just as much as the students need support for their anxiety.
You have to treat the entire ecosystem. If the mother has been the only engine keeping the school system running for her child, you have to repair the engine, not just the car.
Such a great point. So to bring this all together for you listening, we've gone on quite a journey in this deep dive. We started by looking at the raw emotional reality of the modern educational system, the school moms, who have historically served as the invisible, entirely unfunded infrastructure, holding our students together through sheer willpower and exhaustion.
And we examine how that reliance on maternal strength really highlights a massive systemic void, a void that is now legally mandated to be filled, especially with approaching legislative deadlines like Georgia's HB 268, forcing schools to implement real crisis protocols.
Exactly. And we explored how robust, highly logistical structural solutions like the MentalSpace K-12 model are stepping in to finally share that heavy load. We looked at the mechanics of how they are combining same-day teletherapy, dedicated in-school teams, and complex dual-compliance legal frameworks to build a frontline psychological triage unit right down the hall from math class.
And crucially, making it universally accessible by removing the financial wall with $0 Medicaid options.
Right. All of which drives toward highly measurable outcomes that don't just treat a clinical diagnosis, but actually get kids back in their seats learning, while beginning to relieve the immense lingering burden placed on their families.
It's a fundamental shift in how we approach school wellness.
It really is. Which leaves us with a lingering question, a thought to take with you as you go about your day. The source text ended its opening tribute by stating that the strength mothers give their children builds tomorrow. We know they have been the engine, running on fumes, advocating when the system failed. But if comprehensive, school-integrated mental health infrastructure finally takes the burden of constant crisis advocacy off their shoulders, What happens when parents no longer have to operate from a place of pure, hypervigilant exhaustion? Think about it. If that exhausted project manager suddenly gets a fully funded, highly trained team to back her up, what could that newly freed up maternal energy build next?